Hello and welcome to financialaccess.com. I'm Sushmita Panda. Cancer is one of the leading causes of deaths worldwide, accounting for nearly 10 million deaths in 2020. According to WHO, lung cancer is the most common type of cancer after breast cancer. Although smoking is considered as one of the leading causes of lung cancer, recent studies have pointed out that there has been an increasing incidence of lung cancer among non smokers too. The month of November every year is marked as Lung Cancer Awareness Month to raise awareness about one of the world's deadliest disease. To throw some light on this disease, its prevalence, diagnostic measures, challenges, today we have with us Dr. Sandip Shah, Executive Director, Neuberg Diagnostics. Dr. Shah, welcome to financialaccess.com.
Thank you. Thank you all.
Dr. Shah, according to you, how the cancer diagnosis and treatment has evolved in India over the years, and what has been Neuberg Diagnostics' role in it, and also with respect to lung cancer?
See, for any cancer, if you just look at the definition of the any cancer, and specifically when we are talking about the lung cancer, I would like to define in a poetic way the way Dr. Binde has defined it, that it is an abnormal mass of the tissue, the growth of which exceeds than the normal and persists in the same excessive manner after the cessation of stimuli which has evoked it. So it may be applicable to any cancer. So here, what we talk about it, the first thing is that we all know very well that every cells of the body is continuously changing, and that change is required specifically for the meaning of a new to resist newer things, and that is a normal part of the body which is genetically controlled. But if that control has gone, it may be because of the genetic cause, it may be because of the chronicity, it may be continuously insult of that particular area by external antigen. There will be a loss, or we lose the control over that, and that is known as a cancer. Now, how to diagnose that is basically the question, that how and how that evolve, it has been evolved. See, previously, whenever we used to have a lung cancer, whenever it will be diagnosed, that was on those days only with the symptoms. See, symptoms are the ultimate thing which will give you, okay, now there is a genuine mechanical problem in this particular organ, and it has started with that. So previously, we used to able to diagnose only with the help of the symptoms, that suddenly patient has come with a compression, or suddenly patient feel that hemoptysis or some blood has come in the sputum, or suddenly patient may come, there is some heaviness in the lung. Those were the idea, and after that they used to do some cytology or biopsy finding, and they will look at okay, this is the cancer of the lung. Nowadays, afterwards, there is a biggest invention has started with the radiology, that is specifically computerized tomography, CT scan. CT scan is able to identify any change in the soft tissue inside the body, and we will be appreciated, okay, there is something is abnormal, and then we'll go for the biopsy, and then we'll be able to diagnose it. So these are the one. Second thing is that the continuous, what we can say, every smokers should go for the regular checkup. Every year they should go for the CT scan if they are regular chronic smoker, and we may able to appreciate the cancer at the earliest. Whenever we are able to find out the malignancy or cancer earlier, we will be able to treat it very fast, and there are chances that patient may have a complete cure. So that is possible. Nowadays, and when we talk about the Neuberg for the diagnosis, at this moment for the lung cancer, to diagnose, when we talk about the biopsies, the histopathology is the main thing. But for that, you require someone has to suspect it with the help of the CT scan. They go for the biopsy, they take out a small tissue out of it, and then we will do the histopathology. Like Neuberg is having a very advanced center of Neuberg and Oncopath located in Mumbai. And also this Oncopath is also located in Ahmedabad, where the multiple histopathologists are working on the same area. And we have some expert, Dr. Jay Mehta, considered to be a stalwart in the histopathology area. He is also working with us. So Newberg will be helpful in that area. This is for the diagnosis, what I told you. But now, when the diagnosis has been done, then what treatment has to be given? There, the Newberg is genuinely very helpful. Like Newberg is having a specialized setup, which is known as the Newberg Center for Genomic Medicine, based in Ahmedabad, where multiple scientists are working and they find out with the help of the tissue. Okay, they sequence it, the DNA, and they will find out if there is, as I told you, there is a loss of genetic control. So they will find out in which area, which particular gene we have lost the genetic control. And according to that, the patient has been treated, or there's a special, you can say there is a specific missile, or if it's a targeted therapy. So those drugs will act and go only on those protein molecule which has been modified with the help of the genetic sequences and will be treated directly. They will kill those cells and easily the patient will be treated.
Dr. Shah, like, is it like lung cancer is more complex than other cancers? And as you mentioned, like there are various ways to detect cancer. Is it like, since there are two types, I think whatever I have researched on, there are two types of lung cancer. Are the mode of diagnosis of these various types is different?
See, the basically first is a complex. Any cancer is a complex. As I told you, I have defined it very
Mm,
clear. Like if this is some abnormal growth.
mm,
Any. So now, why it is considered to be a complex? The complexity, how fast we will be able to diagnose. Nowadays, in today's scenario, previously all the cancer were considered to be when the cancer name is that we were treating that as a person is going to be cancer from this human being. But nowadays it is not so. If we are able to identify it earlier, there are full chances we will be able to treat. Specifically, when we talk about the lung cancer, considered to be a complex because we are not able to identify very fast. We have to go for the invasive procedure regularly. That is our idea. Not invasive but non-invasive procedure, CT scan with the chronic smokers. And nowadays, because of the pollution, when there is a lot of pollution, you know that those all contains a lot of chemicals, and those chemicals irritate the lung tissue regularly. And those, because of those things also, when we stay in the metropolitan city, there are chances that pollution also creates a lot of problem. And third very important thing is that it's a chronic smoker or passive smoking. You stay in the air conditioned room and someone is smoking there. It means that if you're not smoking, then also you are smoking because you are indirectly smokes regularly. So those are the things again create a lot of problem. So the first thing is that it happens and we are not able to diagnose because no one goes for the regular basis for the CT scan in today's scenario. So we are not able to identify it very early. When we are not able to identify it very early, it means that we are not able to treat it very early. And there is a first symptoms when we talk about. When the first symptoms, it means the disease has progressed a lot. It's not something, symptoms always come when the disease is absolutely abnormal. Then we will not be able to treat it. Now, when we talk about what are different type of the cancer, specifically in the lungs. Lungs is made up from the two different type of the tissue, squamous cell and the acinar cells. When there is any abnormality in any of the cells, if it is a problem with the acinar cells, that is known as adenocarcinoma, and if it is a squamous cell, that is a squamous cell carcinoma. These are the major two types. It has been also divided into two different areas, non-small cells and the small cells. When we this both are considered to small cells, and when it is to be any other type of the malignancy, they are non-small cells. There are not only two types, there are nearly 8 to 9 different types of the lung cancers are there. But if you will be able to identify it early, they are treatable. Adenocarcinoma also treatable. That's the biggest advantage. So that's the way we can identify. Can be identified only with the help of the biopsy, or the directly we will see under the microscope and we will say that okay, this is positive. Very important nowadays to how to regular checkup. That is known as one is the MCED, methylation study. That is will be done from the peripheral blood, which is a highly sensitive method, but not specific. Very expensive, not available in India in today's scenario. They have started in USA. But when it's a very sensitive and not specific, it means if it is positive, We have to identify. It cannot say that it's a lung cancer. It will let you know only the malignancy wherever situated in the body. But then we have to go for lot of investigations to find out where it is located, and that's the main reason still it is not popular. And when it is not popular, it is not going to be price conscious. If the people are using it more and more, it will be going to be price conscious. So in today's scenario, MCED, we will not be able to use it from the liquid biopsy in India in today's scenario because of the high sensitivity and low specificity.
So, as you mentioned about liquid biopsy, could you mention a little more about it? Like, what can be the scope with respect to India? Because I read a lot of reports that, okay, this type of blood test can detect 35 types or 50 types of cancer. Do you think is it feasible in country like India?
As I told you, the methylasis, there is a liquid
Mm.
biopsy used for the two different purposes. One is for the diagnostic purpose, and second one is for the prognostic purpose. When we talk about the diagnostic purpose, that is something, as I told you, that MCD. What other people are just trying to say that we can identify the few mutation from the blood for the BRCA, like for the breast malignancy. So they have identified maximum, you can say 15 to 20 different type of the cancer. There is a possibility is there or not. As I told you, there may be a genetic abnormality, but there's a lot of environmental factors affecting to produce a malignancy. So there are chances genetically you may abnormal, but there are not chances that you have a presently that malignancy. We treat if the malignancy is there. We don't treat the patient if we are suspecting a malignancy. Like as we have always taking only one example that the big actress, she has removed her breast because her mother was having a breast malignancy and she has been found that she is BRCA positive,
Okay.
right? And there she has removed, okay, I don't want because then there's no chance of the malignancy. We don't want to treat because all the females are not ready to take out the breast for that, right? So that is not a question what we are looking at it. But the prognostic purpose, it is really useful for the reoccurrence of malignancy. See, now there is a genetic abnormality. That DNA, when the cell dies, that DNA is moving in the blood. So we will collect the blood. We do not know where because it's a very small cells because there is a no technical availability to find out that small abnormal cells. But that DNA is moving in the blood.
Mm.
We will collect the blood. We will separate out the DNA from the plasma, what is there, and then that DNA will be sequenced. And if that DNA sequence DNA shows that there is a mutation, which has been already identified before from the tissue, the same mutation is again there, we will say that, okay, there is a reoccurrence of the cell, this tissue, and we will treat the patient immediately. And then there is a full chance that patient will recover. So in today's scenario, what we talk about the personalized genomics, which has been started from the peripheral blood, where we are using more than 700 genetic panel to find out, and specifically out of that 35 to 50 genetic mutations we find out for the malignancy, but they are not diagnostic. Make it sure it will give you the probability they are not diagnostic that you have malignancy. So don't be misguided by that. Yes, it will let you know there are chance. Then go for the regular examination for the same. So you may be able to identify it.
So, Indian diagnostics sector has been growing in a very positive way since, especially since the pandemic. And according to you, what are the challenges that the Indian diagnostic companies are facing with the cancer segment as of today? And according to you, what more needs to be done to, to ultimately the goal is, improve patient care?
So let's give me the last answer as the first. Improve patient care, which is very, very important.
Yeah.
Whenever we talk about the only, let's say lung day, we just talk about the lung today. You know, there are multiple mutations. I will just name it that mutations. It's a EGFR, NRAS, KRAS, NET, MET, then the HER2. Those all are the mutations which are present in the lung cancer. We are able to, in today's science, not me, but the basically the world is able to develop a specific drugs against the specific mutation. Previously, when you have been diagnosed with the lung cancer, the lifespan of that patient was not more than a year. But now, if you will say there is an EGFR mutation, the specific drug is available against you, and patient may live for 10 to 15 years. If you have been able to identify the mutation at the HER2 level, and if you give that specific drug, patient may live for 10 to 15 years. So this is the way. The same thing, something like HIV. Then now, if someone is positive for HIV, believe me, that person, if that person is taking a drug, he will not die because of the HIV from something else. So that is the way the drugs have worked. So first thing, the advantage of the genomics. If you are able to identify this type of the mutation, definitely we are able to say. Now the second thing is that what problem we are facing. See, genomic in today's scenario, you will get the DNA. Okay, you sequence it. Sequence means everyone knows about that. All the DNA is having a specific sequence: adenine, guanine, tyrosine, cytosine. There's a sequence. So with the help of the biggest sequencer, when the Newberg is having a largest sequencing machine like the NovaSeq, 2 NovaSeq, NextSeq, and other machines, you sequence those things. Like if you say the one cancer panel for the 500 genes, it will generate the data of more than 50 to 60 GB. Just imagine. And that 60 GB data, you have to interpret, you have to assess it. So you require a very good team of the bioinformatician. No doubt, not many softwares are coming up because of that, and we just push it in the software. From that abnormal mutation, you have to find out, is it a pathogenic or non-pathogenic? There are chances that few mutations may not produce any abnormality, but we have to see that. Today, we may say that there's a normal mutation, but tomorrow, we may identify that this can create a problem considered to be abnormal tomorrow. So that data has to be reviewed again and again, not only once. If I have sequenced today something, and I will say today is normal, after a year, if someone will find out, some researcher will find out that this can produce this disease, then we have to have data with us. We have to store that data, review it again after a year, and report it again. So that is another problem. So to store the database, specialized people, sequencing facility, and the interpretation, that is the biggest headache for everyone. So you won't get that many good brain to work on it. And you accumulate those brain and work on it and give the right report. That is the biggest challenge for all the genomic laboratory to this scenario.
Thank you so much, Dr. Shah, for joining us. It was really insightful. And thank you for all the great information.
Thank you. Thank you.